All right. Hello, everyone. I am Dr. Purney, and welcome to RN2Real Talk. At RN2 Professors, we are all about helping you build your nurse brain from day one. So, we are an online educational resource, and whether you're a student, a new grad, an educator, or you're deep in the NCLEX prep, we want to be your guide for making clinical judgment second nature. So today we are going to dive into the NCLEX strategy. We're going to talk a little bit about stress management and how to think through those tricky questions. But I'm not going to do this alone. I have a wonderful guest here that's going to help me, and she has coached countless individuals through NCLEX and passing exams. She is my partner in crime, and she is the founder of RN2 Professors, Professor Wick. Welcome to my first podcast for RN2 Professors. And I'm so happy to have you here, and I'm really excited to share with you on our journey. I know you work closely with students prepping for these types of exams. Can you share a little bit about what you do and what of students you usually work with?
Sure, of course I can. First, tell you a little bit about myself. I've been a nurse for over 15 years and also a nurse educator. And I work with students at various points in the nursing program, all different skill levels. And what I really do is to help them build their clinical judgment and their confidence.
I think you do that very, very well. So tell us a little bit about RN2 Professors and what drove you to start it, kind of your mission of RN2 Professors is.
So with RN2 Professors, it has been in the works for a long time. Started out as an NCLEX review. But as I was teaching and working with students, what I found was that students were having a very difficult time making a connection between what they learned in the classroom and what they do in clinicals. And all of that really has to do with clinical judgment and confidence. And I really saw a need to be able to help students and nurse educators make that connection for the students. And that's really the goal of RN2 Professors.
What makes us stand out from other types of resources that are available to students?
What makes RN2 Professors stand out is that we're not about memorization and learning skills. There are a ton of excellent resources out there that already cover that. What we do is take that to the next step, taking it to the next level of making again that connection, using that clinical judgment to bridge that into what we do in sim, in clinicals, and even how students are tested.
I would agree with you there. I think that RN2 Professors is very innovative. We reach a lot of different audiences, and we hope that you, if you're listening today, that you will follow us and see what's coming because we have a lot of great material and information that will be available to you in the coming days and weeks. So, what are some of the most common concerns that students come to you with when they are first starting to prep for an exam or for the NCLEX?
That's a good question. So students come to me with a lot of questions before a test. The biggest ones are what is going to be on the test? How hard is the test going to be? How many questions are going to be on the test? And the biggest one is probably how do I study for the test? What they really need to do is look at the concepts that they're learning. So it's not, again, about memorization because they really need to make clinical decisions when they're answering questions. So understanding the concept of what they were taught. And this needs to come from every resource that they were given in the classroom, not only the lectures, but also their books and any additional resources that their instructors may give them, because then they can answer whatever the question is.
I think you really hit home with that. Concepts is really the way to go because you cannot possibly memorize everything. That's why we teach students to carry around resources and put resources on their phone, such as, medication resources. You're not going to always see every medication you give in real life in nursing school. You may not have learned about it. Plus, there's new medications coming out all the time. So understanding the concepts and then being able to be resourceful by using additional resources and support can help the students and nurses be successful. Let's break down how we can manage a test and make it a little bit about being more human and not feel so overwhelmed by the semantics of a test. All right, so we're going to break down the NCLEX and how that works. We're going to make this manageable, realistic, and a little bit more human. So let's talk about how the NCLEX even works. The underlying algorithm to the NCLEX is called computerized adaptive testing, or CAT. So what that means is that this exam, this NCLEX exam or test, changes based on how you're doing. When you get a question, you will probably get a question that's relatively easier. It's a midline question. It's not super hard. It's not super easy. And then the exam's going to wait to see how you answer. If you answer right, it's going to give you a harder question until it gets you to what they call mastery. Now, if you miss the question, then it's going to adjust, and it'll keep adjusting until it can determine whether you are mastering in that area or not. So if you're not competent or if you haven't mastered that area based on this computer adaptive testing, then you may not pass that area, and it could cause you to not pass the NCLEX entirely. With that being said, Professor Wick, how do you explain the computer adaptive testing to students in a way that takes the fear out of it? Because it is kind of scary when you think about the up and down.
Yeah, absolutely. I mean, I remember when I went to take the NCLEX and the not knowing of what was going to be on the test or how it was tested. And with this test, I think that you explained it very well about how adaptation works. If you answer it right, it gets harder. If you answer it wrong, it adjusts. One thing, too, that they have to think about is what the exam actually focuses on. And I think that that will help with building confidence because the exam focuses on clinical judgment in 4 major categories: safe and effective care, health promotion and maintenance, physiological integrity, and psychosocial integrity. So, one thing that you have to understand when taking the test is how to apply your nursing knowledge, prioritization, safety, and decision making in every one of those categories.
And that's really important that students really review that. They look at the NCLEX test plan because it does do a nice little review of all the categories, what types of clinical interventions are associated with those categories. And I think that's really important to understand what the test is about. When I took the NCLEX, which was a long time ago, I was a first year NCLEX taker. They used to do tests in 3 days by the state. We didn't get much information about what was on that. And we were told you had to get between 75 and 150 questions and it could shut off at 75. I got 91 questions and I didn't even understand if that was going to be a good thing or a bad thing, but I passed, thank goodness. So now students have a lot more information about what to expect with the test. Not to mention you have a lot more to know, I think, than what I had to know 30 years ago. So definitely follow the NCSBN and take a look at that NCLEX test plan as well, besides our little talk here, because I think that will help you have a better understanding, and knowledge is powerful.
Exactly. And remember, as we keep saying, memorizing facts is not enough. You have to show clinical reasoning and make sure that you're practicing. Use those NCLEX style questions. There's plenty of books out there, especially case studies, and use CJMM as you go through to help you answer those questions.
Practice makes perfect. That's what I always say. I'll give you some more information about my life. Before I became a nurse, I was in the military and I had a drill sergeant that used to say, perfect practice makes perfect performance. So that's what we want you guys to do. We want you to practice perfectly. There's all different types of questions that students may get on the exam. Can you talk a little bit about those types of questions?
Yeah, absolutely. There's quite a few different styles of questions that you can get on the NCLEX, including new generation or NGN type questions. But honestly, those are still a minority of your questions. The majority of the questions on NCLEX are still going to be multiple choice, multiple response. So that's select all that apply questions, drag and drop, hot spots, and like I said, case studies.
So the bottom line is this exam is not asking you to memorize. It's asking you to think like a nurse, and we're asking you to train your nurse brain. So let's get into the meat of this. Let's talk a little bit about test strategy. We've talked about practicing, the types of questions. We've talked about how the NCLEX works, but let's get down to what is the actual strategy that you need to learn and embrace as you're learning how to prepare for the NCLEX exam. If you don't follow these strategies and you continue to just memorize, that NCLEX will eat you alive. So we really want to see you guys be successful and hone in on some of the best strategies that they have out there for you to use. So you need to think through the patient safety, of course, and what matters the most in the moment, and how to use your nursing judgment. Professor Wick, what is one of your go-to strategies when a student says they keep second-guessing their answers?
Well, one of the things that they need to do is slow down, look for keywords, and make sure that you are really looking at the answers. A lot of times, what students will do is they won't trust their gut. And that's another big thing that you need to do. Even we always say that, even when you become a nurse, we learn to trust our gut in a situation. And I've seen so many students put the right answer in on a test, second guess themselves, and then change it to the wrong answer. And I will tell you 90% of the time, it is changing it from the right answer to the wrong answer. So slow down, trust your gut.
I agree with you, Professor Wick. I think that you definitely need to trust your gut. And I recently took an exam for certified nurse educator, and I had to take it more than once. And I promise you that I had to use those strategies. I had to trust my gut. I needed to slow down. I needed to take a deep breath before I answered those questions. And I needed to remember to prioritize, because prioritization is always a big one. I always tell my students, if it's an airway issue, nothing else matters until that's fixed. You don't have a patient that's going to be alive if they can't breathe. And of course, keep in mind Maslow's hierarchy is your friend. Physical needs will always beat those psychological needs every single time. Another one, if you see words like always, never, and only, be skeptical, because nursing's not black and white. It's very much gray. And those select all that applies, we talked about those a little bit ago. Students always panic with those. Professor Wick, how do you coach your students through those select all that apply beasts?
That is one of the top questions that I get from students on test taking strategies is how do they deal with select all that apply? And I'll tell you my number one tip for it is to treat the answers like true and false statements. So really read that stem and then go through and look at each answer individually and ask yourself, does that answer what the question is asking you? Don't look at the questions as a group, right? Because that's a mistake that a lot of us make, including myself. I look at the answers and I think, oh, I've already picked 3. I can't pick another one. Or I've picked too many. I need to get rid of one. You can't look at it as a group because honestly, select all that apply can be anything from every single one of those answers to one. And that is the truth. So you need to look at each individual answer and say, does this answer the question?
Here's a trick I love. Rephrase the question in your own words. Maybe you're not sure what the question is really asking. So by rephrasing it, making sure you understand the question, it may be easier for you to answer as well. Now let's talk about that elephant in the room, test anxiety. I've seen it derail even the smartest students. Professor Wick, what do you see most with these students that start spiraling before an exam?
What I see most with the students is that, again, they're not trusting themselves. They're not trusting that they know the information, that they know the knowledge, that they can make that clinical decision when it comes to test taking time. And again, a lot of this, and we're going to say it over and over and over again, has to do with building that clinical judgment and trusting yourself. Trust yourself, not the test anxiety. You know this information. You need to apply it.
I agree with you completely on that. Here's what I tell students. Deep breathing is not just fluff. It resets your nervous system. And your brain, it needs that deep breathing so it can reset as well. You need to have fuel and you need to have rest. Don't cram the night before. You should be studying along the way. A little bit every day goes a lot further than one long standing study session because you're going to forget. And that's when you're trying to do memorization. So get some sleep, eat a good breakfast, and make sure you're well hydrated. And like Professor Wick said, trust your instincts. The first answer that you usually lean towards is probably the correct answer, but then you are really good at talking yourselves out of that answer, and then you change it. And when I've talked to students about exams as well, they always tell me, I had the right answer, and then I changed it because I thought it meant this, or I was thinking about that. If it's not in the question, it's not part of the question. People love to create scenarios around a question that's not asking for that scenario. Take your time, trust your instincts, and breathe. All right, how about we do this now? Let's do a little practice round of prioritization. I'm going to put Professor Wick to the test, and we're going to do some questions and see how she does. You ready?
Ready.
Okay, question number 1. Your patient is short of breath. What's your priority? A, encourage deep breathing exercises. B, check the patient's vital signs. C, administer oxygen. D, call the healthcare provider.
I would administer oxygen.
And why would you choose that answer, Professor Wick?
Because the question is asking you for an intervention, and that is the priority intervention that you can do right there at the bedside.
Perfect. She got that one right. Ding, 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 ding. Question 2. You have 4 patients to assess. Who do you see first? A, a post-op patient with a fever of 100.4. B, a diabetic patient who hasn't eaten. C, a patient requesting pain medication. Or D, a COPD patient who is short of breath.
Oh, the COPD patient that's short of breath.
And I'm sure you're going to give me the same reason that you gave me for question number 1. Am I right?
Absolutely. ABCs, guys. Airway, breathing, circulation, and
then
as
neuro.
Dr. Purney says, and neuro. Yes.
And then neuro. All right, last question. A patient's potassium level is 2.9 milliequivalents per liter. What is your first action? A, encourage potassium-rich foods. B, place the patient on a cardiac monitor. C, administer oral potassium. Or D, notify the healthcare provider.
Definitely want to get that patient on a cardiac monitor, because with a potassium level that low, they could have dysrhythmias.
Absolutely. And I do want to point out in this question, all 4 of these things are something you would do for the patient. But the key to this question was, what is your first intervention? What is your first action?
Prioritization, guys.
Prioritization. So these are not just right or wrong answers. These are things that you have to do that are called judgment calls. Think, what keeps my patient the safest right now? All right, friends, let's land this plane. NCLEX isn't just a test of what you know, it's a test of how you think. Professor Wick, any final words of wisdom for our future nurses?
Just remember that you're not studying pass an exam. You're studying to take care of the lives of every patient that you touch.
That's really good advice. And remember, you have this resource here, RN2Professors, to help you along the way. If this has helped you, or if you enjoyed our podcast, please share it with your cohorts, your fellow students, your nursing program, anybody that you think would be interested. We want you to subscribe, follow, and check out rn2professors.com for more tools to sharpen your clinical judgment. Everyone, you are closer than you think, so keep going. We're cheering you every step of the way. And thank you, Professor Wick, for joining me today in my first podcast for RN2Professors.
You're welcome. It was a pleasure to join you. And remember, everybody, the links are down below in the description.
Have a wonderful day.